Hi everyone, today is 3rd of July, which is Friday, time around 8 o'clock. Welcome to our webinar platform. Mr. Ertan Erel, welcome to us. Thank you very much. I really appreciate you accept our invitation. I know you are very busy. I think you saw in a couple of hospitals. So during your busy calendar, schedule, you accept our invitation. Really, I appreciate about it. Plastic and reconstruction surgery, but you have many more titles. So please let us know a little bit more about you, Ertan. Thank you.
Show my presentation, which will have a bit more information about me. Can you see it on the screen?
Yes.
Yes, so I'm Mr. Ertan Erel, a plastic surgeon practicing in UK. I finished Ecin University in Izmir, Turkey, and after that I came to England and I passed the FRCS examination, which is followed by Master of Science in University College London. Following this, I joined the plastic surgery training and I've got the FRCS Plus title. So I do have 3 diplomas on top of my medical degree. I'm registered with the General Medical Council. BAPRAS is the Plastic Surgery Association, and the BAPS is the cosmetic side in UK. And also I'm registered with the Turkish Plastic Surgery Associations. I currently have 25 publications and 50 presentations. Some more publications are on their way. And I've also written a book chapter on breast reconstruction. I currently work in the NHS in Stockholm-Trent area, Royal Stoke Hospital. I've been recently appointed as an associate professor in Georgia. The main aim is to help the students in Georgia to come to UK and have some practice. So I'll be lecturing and coaching them in the coming years. I do have private practice in Staffordshire. That's where I'm based. I also go to London and also have a small practice in Glasgow, depending on the request. So I'm a specialized surgeon, mainly doing the breast reconstructions. And I have interest in breast surgery and facial surgery, especially the rhinoplasty. I do perform body contouring procedures, including liposuctions, for people who lost their weight, and if they need body shaping, I have a special interest in that. I will show you a few examples of my patients, pre and post-op photographs, so you'll have a better understanding of the procedures. This is a rhinoplasty as well. This patient had a very flat nose, so I had to build it up his nose by taking ribs to build it and make it more projecting. This patient had a very droopy and slightly sort of nose that it's got a bit of hump, so it's shapen and lifted up slightly. This patient was traumatized before, so his nose was shrunk in a way that I had to lengthen it with a piece of a rib. My main specialty is the breast, and you can see a breast implants before and after. These photographs are also available on my website. So I do choose appropriate implants for the patients. Uplift is another procedure that the breast can be lifted with surgical procedures. And this is a combination of uplift and implant. As you can see, the patient has a asymmetry beforehand, which is also be corrected post-operatively. You see the nipple levels were slightly lower on the left side. Breast reduction is another procedure that I do regularly perform. And this lady had a very massive, big breast, and she's a young lady, so she had to have the reduction. This is a tummy tuck. You can see the other view, the scar from one end to the other end. Massive weight loss is a challenging new surgical area. So this lady lost a lot of weight following bypass surgery, and her breasts were lifted up, and her tummy excess tissue was removed. And you can see it on the post-op photo. She has a scar behind the elbow area. Because this is an extended tummy tuck, I do take the sides of the abdomen almost to the midline, so that excessive skin and the tissues are removed, and she's very pleased lady. Another problem could be the arms, that patients can have saggy skin in the arm area, and this is a brachioplasty procedure. You can hardly see the scar, which is hidden in the inner part of the arm. I do have a website, as Arzu mentioned, it's the Erel Plastic Surgery website. You can get more information, and if you like to have an appointment with me, or if you have questions, there is an email link that you just need to fill a form in, so I can get back to you. You can see some of the hospitals I practiced in London here, and other hospitals at the bottom. So you can find all this information in my website. This was an article in the Turkish media in London, that I started practicing in London. That's all I can say at the moment, but if you have got any questions, I'm happy to answer.
Thank you very much. Ilay also joined us, but I'm not sure he can be able to mute the voice.
Yes, hi.
Oh,
yeah.
Perfect. Welcome, Ilay. So I already told the attendees that you are going to be a little bit delayed. So welcome.
Yes. Thank you. Sorry about that. I had an issue, and I'm now at Birmingham Station, actually. So apologies up front if there's any extra noises we wouldn't normally want. But yeah, I'm here.
Thank you so much. And we really appreciate you accept our invitation. We know that you are very busy, especially this week. You just reopen again after the long break.
Yes.
You are traveling one city to other. So thank you very much. Really appreciate that you accept our invitation. So I introduced Ertan, and he did his presentation. It was great, actually. I have a couple of questions later on to him. But before that, we can also ask you if you could tell us a little bit about yourself. I know that you are the laser and implant dental surgeon, but you have many more titles, which you could explain better than me, Ilay Maden.
Thank you. Yeah, it's a pleasure to be here. Thank you for the invitation. Who I am professionally is I am obviously a dentist. I have completed my master's studies in Germany on laser dentistry, and my PhD on gum disease and gum health in Istanbul University in Turkey. And we have been practicing in the UK now more than 3 years, maybe 4 years now. So we are based in London, central London. Our practice is on clinic, where we carry out all stuff to do with teeth, gums, mouth, and more, including snoring treatment and other treatments. So we would like to have normally a holistic view on the patient. So we know when many people think about dentists and what they do, it's limited to teeth or replacement of teeth. But the more we know, the more we look into health, we see that everything is interrelated, especially inflammation and infection, which is nowadays very, very hot topic. And we know that people, for example, react differently to infection to COVID. Some are symptom-free, whereas others are having more symptoms or even more deadly results. And we know that it's all to do with the inflammatory storm. So that's the overreaction of the body. And we know all inflammation in the body is interreacting, including the gums, the gut, and any other infections possible in the body. So yeah, so that's what we do. Try to bring health to the patients, starting from the mouth and usually systemically also.
Okay. So I'm really curious to hear about more the laser treatment you do, latest treatments. You have some latest treatment. So if you could able to share your screen and show us your webpage. I tried to show on your Facebook share that you reopened and start with the mask and very protective, which is really good for us. But you can tell us more how you restart after pandemic.
Yes, sure. I can maybe mention a few things about that and then go on to the website. Yeah, it's been a pleasure also to be open again because we had many, many patients trying to reach us during the lockdown. We were only able to help them with online consultations and prescriptions, which did help some patients, even though we normally don't prescribe antibiotics very frequently unless it's really, really necessary. Especially because we have the advantage of using the lasers, which is the best, one of the best disinfectants for infections. But yeah, during the lockdown, we did prescribe a few. Now being back to work, being able to help our patients, I think it's a good feeling for both parties. So what we're doing to make sure everything is safe, we are already digital dental practice. We do loads of stuff digitally, including some impressions. So we don't use these GUI impressions for restorations and stuff. For example, we do 3D scanning. We have 3D scans for X-rays and so on. Now we have also digital online systems for our patients for payments, even self-check-in to the practice, because we are trying to reduce the amount of patients coming into the practice at the same time for social distancing. Safety-wise, we have all high-end masks. We have fogging to disinfect the air and the surfaces. And as many of you would guess, dentistry is already a safe environment because we're dealing with possible infections all the time. So it's totally safe. It's just a few adjustments we needed to make, and until we had some clearance from the government, and now we're back steady. Coming back to our website, let me share my screen.
How many minutes approximately gap between patient to patient to clear up and for the hygienic rules?
Depending on what we're doing, it's from half an hour to an hour, but we also have an air purification system in place, which works actually during the treatment, and there's some machine coming quite close to the patient's face. It's a bit loud, but it helps us to reduce any aerosols, which was the topic of discussion, whether to open the practice or how to open it. And we have high volume suction, as we call, in the mouth and just close to the face. That's removing 99% of the aerosols anyway, but we still wait at least half an hour between patients or change rooms. So that's what we do to make everything safe. So now, okay, I think it's now online. Sorry about my angulation. My camera is below my screen, so when I'm looking as if I'm looking up, I'm actually looking at the screen. Normally I would use my...
I see clearly. If our guests are seeing clearly, they can type it in chat box.
All right.
I don't think any problem. Yeah.
Yeah, this is Dilek, our partner, and Özge. Özge is also my wife. Dilek is more interested in some facial aesthetics and also some gum treatment. Özge does our dental aesthetics, root canal treatment, and digital dentistry for full mouth reconstruction with restorations and so on. And I deal with more surgical stuff like in gum, some gum grafts and implants, and also laser treatments, which I will talk about in a minute. So our website is onconic.co.uk. I think you can also see that. This number is on the top. It's also a WhatsApp number, so if anybody wants to reach us through calling or WhatsApping, that's also possible, and you'll see our email later. It's smile@onconic.co.uk for any inquiries. So first of all, that's the first thing in the list, as you can see in our website. We do welcome nervous patients. We are very patient. We understand why patients might be nervous visiting a dentist, and we always want our patients to come over that, so that they are more relaxed. We take our time with our patients to chat to make sure that they are feeling good. And laser helps a lot with that, because the main issue, of course, with dentistry is pain. For most people, it's associated with pain. And we reduce that to a minimum, even without numbing patients. So injection phobia is a big thing. With our fillings and many treatments, we don't do injections in 90% of our cases. So that's due to pain reduction with the laser. Then the laser treatment, there are a few. The things that I'm mainly interested in and then provide are the gum disease treatments. So as I mentioned, this disease, gum disease, is known, very well known in medicine, to be related to diabetes, heart issues, Alzheimer's, lung issues, if the patient is pregnant, early birth and low birth weight for the baby, and many other systemic issues. So it's very important to be able to tackle that. So for the patient, it's important to know that they have this disease. Mainly it's through bleeding and discomfort with the gums. It doesn't cause any pain. That's a disadvantage, because patients may not realize they have it. And especially with smokers, the disease advances quicker, but the symptoms are less. So they would not even realize that the tissues are being damaged unless they visit the dentist. So it's very important that they have these regular visits to the dentist. So what we do is there's a mechanical cleaning portion. Everybody is familiar with descaling and polishing. We just do a little bit of a deeper version of that. But what the laser does is it removes the concrements on the roots, which we want to remove, the plaque, which hosts the bacteria, which cause the infection. And we detox. So we also remove the toxins, which is very important for the anti-inflammatory treatment. And then we have another laser, which disinfects the sites, so kills the bacteria directly. And it also stimulates the tissues for better healing. So these are the main advantages on top of mechanical cleaning, which is the conventional way. For implants, again, implants are done usually to replace teeth. So the teeth are, again, if they're not fractured or cracked, they would be infected. That would be why we remove the teeth. So it's very important for us to use the lasers to disinfect the extraction site and then go on with the implant later on. That reduces the risk of further infection later on around the implant. So to minimize the risk of peri-implantitis, we use the laser. And cosmetic dentistry, again, we use the lasers for bleaching, for full smile design. So we also shape the gums, which helps with the aesthetics of the white part. So teeth and gums are always together, and there's a balance that we need to have. And again, laser is a big component there, especially on the gum bit, where we want to reshape the gums. Because conventional, that would be with a full-on surgery, and with the gums, usually we can do it without stitches and very minimal healing time. We also use lasers to help with contouring the face, the lips, and the reduction of wrinkles. And another topic that I'm very passionate about is anti-snoring treatment, because there are two levels of this issue. The snoring is obviously a nuisance for the sound it makes, and it usually is picked up by the partner rather than the person who snores. To reduce bruising, elbow hits in the night, but also to actually elongate your lifespan, it's important to get that treated. So what happens with snoring is the airway at the back of your throat gets reduced in volume. That causes the air going through to vibrate the tissues. So that's the sound, the vibration of the throat. What happens is, if there's still air going through, it's just a vibration, and the problem with that is a possible plaque forming also on the main veins in the throat, and if those plaques, if they get dislodged, and they could cause issues with the heart or the brain. So that's the main risk with just snoring. So there is a health risk with snoring other than partner issues. The other further issue, which usually is a progression, so it usually starts with snoring, and it progresses to apnea, where the airway actually clogs up totally. So the walls of the airway actually touch each other, and there is a time where the patient actually cannot breathe while they're sleeping. So sleeping is normally a regeneration time for the body to rest, but if there's no oxygen going to the body, it's a struggle rather than resting. So depending on the severity, it could be few seconds, few minutes. So a few minutes obviously sounds weird, but it happens. That's the more advanced version of sleep apnea. And this snoring treatment is also very helpful with this apnea. It doesn't necessarily solve the whole issue, but it helps to reduce. Why it's also very important is because the other two options with apnea, there are only, well, three. So there's a surgical option with also lasers, but it's very, very difficult healing time, and it takes a long time, and usually it relapses. The second option, other than what we do, is a device that we also apply to put in to move the jaw forward during the night, which helps with the airway to be enlarged, because when the jaw is moved forward, the tongue is also moving forward. So that's also helpful for some of our patients, but then you sleep with something in your mouth. The other thing is CPAP machines, which would be prescribed by GPs or actually sleep centers and the ENT doctors, where they have a mask on their face while they sleep, which is also usually plugged in, which is very difficult to put on, but it's a health life-saving machine. So the issues with compliance with these options usually brings patients to us because they have no other option. What we do is we use the laser without any surgery, without any side effects, without any downtime. We apply it on the throat and the soft tissues and also the tongue, so that the tissues actually firm up and shrink. It's just like going to the gym and when your tissues are firming up, which makes the tissues stronger, so they are not saggy anymore, so the vibration is much less. Airway is more in volume, and that's how we try to help our patients. So it's a package of like 3 treatments every 3 weeks as a minimum. With more severe cases, we need to do 4th or 5th session, and it's incredibly nice, and it's good to get the feedback of the patients usually after this treatment that their life changes. It's not just the snoring, as I said, it's better sleep, better regeneration, so that they have better awakeness and then focusing during the day, and yeah, everybody's happy, including the partner. So that's about it for the snoring. We also use the same laser disinfection and cleaning for our root canal treatment and many other treatments. So this is our website. On the left is supposed to be a map here. I don't know why it's not there, but you can see the address and the email. Obviously, we can only book appointments through contact. We are not able to operate as a walk-in practice as due to the current situation. But yeah, you can email us, call us, or WhatsApp us.
So for the first appointment, you basically charge for the front cost. But
yes,
as you mentioned before that I was inviting people and saying that they will get a voucher. So end of the webinar, I will post it, the voucher, that you are really happy to give the attendees today. If you book any treatment, any on-clinics treatment, so you won't charge the front cost.
yes, it is actually when it's free of charge, don't feel that it's less important. It's a very important session throughout the treatment, because we need to chat what the issue is, what else you can do other than visiting us in our treatment. Usually there are add-ons, and what you can expect from the treatment. So that's an important chat, and yeah, I'm happy to have that through you.
That's great. So I'm gonna publish, they can grab, and when you book, they can give the promo code. There's gonna be promo codes for the attendees, which is great. So I have, you sent me before that I have a short video of the on clinic. If you want, I can show now if you finish your presentation.
Yes, I'll just stop sharing.
Yeah, I can take the screen from you.
And I'll mute myself just in case there's any sound coming in from here. And if there's any questions later, I can respond.
This your video on our YouTube channel that people really like it.
You smile. What makes you smile? Shared moments. Moments of freedom. Moments of joy. No matter when or where, your smile is unmistakably you. Based in London's prestigious Harley Street, at On Clinic, we are here to preserve your unique smile. Our team of friendly expert clinicians use the latest cosmetic dentistry techniques to make sure your smile always reflects the inner you.
We can hear it now. Yeah, we can watch at the same time. Can you hear it?
Unit of the plastic surgery. He's also very much involved in the Turkish development of plastic surgical unit. He is also involved in Izmir, part of south of, if I'm correct, to the east of Turkey, developing community development of the medical services. I call upon Mr. Ertan Erel to come and receive the award.
Yeah, I watched it before. Your voice is not.
Yeah.
Yeah, you can.
Yeah, so this Essex Medical Society sort of awarded me for being a doctor, because we do have a Harley Street group, about 25, 30 doctors working together, and also have links with different organizations in London, mainly the Turkish ones, and also do some business network with Turkish business people from Turkey. So that's why I was given an award, being a good doctor, and also establishing various links with different organizations.
Not just a good doctor, it's a great doctor, I think. Yeah, I can also show, because I don't want to take the screen again and again. So this is the gift voucher I will send all the attendees from Ertan Erel, and he's happy to give 15-minute free consultation if you send the inquiry to info@erel Plastic Surgery CO UK. So you will be able to chat on the phone, or that he's gonna show the instruction that how you can connect with him. Probably during this time, everything is online, so you could do online consultation with them. This is from OnClinic, all the information here, how you can connect with them, email and phone number. As he mentioned that you can use this number as a WhatsApp chat also. So the pre-consultation worth 195. As Ilay said, that it is really important part of the treatment. So you could describe what exactly you need from them. So that's why it's a bit expensive, but they are happy to give free if you book any other treatment with the promo code SE webinar. So I will send all these 2 vouchers through the email to you after the webinar. So I can stop my screen and come back to you. We have a couple of questions. Do you need to add anything before we go to Q&A session?
I just wanted to say I also have a non-surgical practice, which is expanding in our plastic surgery, because rather than having especially the facial operations, we are here to provide with some fillers and Botox and threads to, you know, make faces look younger and fresher. So I do provide this sort of services.
That's really good, because I really need Botox. And do you do anything for this neck wrinkles?
Yes, I mean, especially Botox is possible for the neck because you have a platysma muscle, which can be weakened with small Botox injections. Also, there are some new fillers that came into practice in the last few years, that 10 injection points in the neck, which forms a little lumpiness in the first day, but the next day is gone, because the filler travels in the neck and just fills the gap in a way. And this injection can be repeated every 3 months or so. It may be required once more in the initial phase, and then 3 monthly or 6 monthly, according to the need. You can have an injection which also helps to regenerate the neck rather than just filling it, because it causes some sort of scarring in the subcutaneous plane. So I do use that, you know, that sort of fillers as well, which is just, you know, part of the plastic surgery practice now.
How often do you come to London for any treatment? I know you are working with one of the hospital here, that probably we can arrange an appointment with you for the Botox or filler. If anyone would like to have a session with you, they can send a request to you or to me that we can organize.
My usual London visit is every 2 weeks. But because of the COVID-19, we had to have a bit of a break. But I will be resuming my London visits in July. So if we have some
specific dates that we can arrange,
I would say
to my friends, because everyone needs the Botox. We stuck at home, you know, we couldn't do it long time.
Yes, I mean, in the next few weeks, I would say it's possible. Next week is possible if somebody is interested, because I'm off next week. And then in 2 weeks' time is possible, or 3 weeks' time. So we can maybe have an idea about, you know, how many clients are there and what are the suitable dates for them, and arrange either one of the weekdays or a weekend to have the treatments.
I remember I used longest filler that you made, I think 4 or 5 years ago in London. It stand here. It was perfectly minimum 3 years. I used very happily. Probably I will need again. If any ladies here as our guest, you can drop a message on the chat box to me. I will organize.
Why just the ladies?
Yeah. So yeah. Any gentlemen also. Yeah. for me, easy to communicate with the ladies at the moment. But yeah, if any gentlemen or ladies, please drop a message. I will organize. Ilay, you say that you do laser treatment for cosmetic, non-surgical.
Yes, we do to complement that kind of treatment. We use the laser to either to regenerate the tissue a little bit. It kind of stimulates collagen production from within. So it has some limitations. It's more subtle look, more natural look. So we can really plumb it up, like if the volume is too little already. But in some cases, it's quite good. And we also use it for skin resurfacing to reduce some wrinkles also.
Do you have anything for these pockets here?
Yes, nasolabial folds, yes. It's the same thing. So we apply it actually in the mouth. So usually laser treatments are not a good idea in summer months because you could have some complications. But because we use it in the inside of the mouth, it's the same effect. It just affects also the thickness of the, let's say, the tissue, the skin. And then the filling up will have an effect on the outside, on the skin.
How long they will be able to use after?
It's this. I think it's similar to fillers, 3 to 9 months, depending on the case. Okay. So they would need a repetition, but yeah.
That's great. So let's go back to the chat box first. I saw earlier that someone was thanking to Ertan. Yeah, Metin Nizamoğlu. Thank you very much, Mr. Ertan. Great talk. Can I please ask if the Augmentation Mastopexy, I don't understand, Ertan, you can read clearly, was done in a single stage or 2 stages? Did you understand?
Yes, it's Mastopexy and breast augmentation. These are the 2 different procedures. One of them is the breast uplift, and the other one is the breast augmentation using an implant. I do perform these operations individually or as a combination. And the combination could be a little bit of challenge because breast is lifted and also made bigger. So the nipple area becomes tight. So there is a experience required to achieve a good result. Usually the patients don't want to have 2 operations, they just want to have 1 and the ideal result. You have seen one of my young lady's photographs earlier on in my presentation. So she had that combined procedure, just a scar around the nipple, and the implant was put just underneath the nipple. She has no other scars. So that's, comes with an experience.
Your voice gone, Ertan. Your connection gone as well, okay.
You hear me now?
Okay, you back?
Yes, I think it's went into silent. Okay. Sorry about that, it just cut off. But, yes, the operation can be done as a combination, but there is some experience required. So that's what I will advise as a young trainee. They need to have a bit of experience to do this operation. It's safer to do it in 2 stages if possible.
Okay, I think related to that question also, Abid Rashid was asking, Mr. Erel, how is your experience of 1-stage augmentation mastopexy?
Yes, I have great experience with that. And I usually do periareolar, means just around the area mastopexy. Sometimes I do a vertical scar if there is an excess skin, and sometimes I can extend that to the inframammary fold by making a small T, and all my patients seem to be happy.
That's great. Also, someone tag your name, Ertan Erel. For light improvements in skin structure, do you also give advice for nutrition? Joe's bores.
Yes, and nutrition is important for skin. So vitamin E is good. You can have the creams, and also you can have some supplements containing some collagen, and them is possible to get them from health shops. Healthy eating, and also if patients are smoking, they need to give up smoking, because smoking can affect the skin very badly. On top of that, there are some natural sort of skin moisturizers that can be obtained. If you think about a skin and the brick layers, sort of bricks brought together, if the skin is dry and hasn't got much nutrition, and there will be some gaps between the bricks, and that's where you get the wrinkles and the dryness. But these areas needs to be fed very well with the hydration from outside and also from inside, plus the nutrition, so the patients have a well-nourished skin.
Okay, I hope they got their answers. Also on the poll, I forgot to mention the Ireland, but someone joined from Ireland. A bit sorry, apologize. So he said I skipped the polling because of that. Yeah, I think
talking about supplements, just again because it's really relevant to current situation, vitamin D supplement is very important. I would strongly suggest everyone, because in the UK, sunbathing is not always possible. It's more and more due to the global warming. But in general, if you have a deficiency of vitamin D, it's not good for inflammation, general health, many effects. Because vitamin D is called as a vitamin, but it acts like a hormone. It's also important for bone metabolism and dental health. But especially for COVID infections, there are lots of studies, and now even a book is coming out on that subject. The vitamin D supplement is very important with vitamin K2. It should be taken in combination. It's helpful for everything.
Great. Okay, we have some more questions in Q&A box. As you see, hi, do you do braces for kids, Ertan? I think.
Yeah, braces, yes. We have Sedef with us, who's has also special interest in orthodontics. So yes, we do.
Okay. Another question: do you do root canal treatment for kids?
Depends on the age and case. Mostly yes, but we would need to see. And if in case if we can't help, because it's maybe the only thing that we might need to refer the patient, we can do that also.
Okay.
But mostly we do.
Again, there is no mentioned name, but you could guess who will be answered. Would you recommend clear braces? Are they as good as the regular ones?
That's again braces probably. Yes, it depends on the case. Again, Sedef would need to inspect you and then tell you the advantages and disadvantages of options. We have clear braces, aligners. We have normal braces, ceramic braces, and even we could, in more rare cases, but we can even have braces on the inside that are not visible. Obviously, each technique has advantages and disadvantages and different costs.
Okay.
We do all.
Thank you. There is another question from Fatma Dreisen. Where are you normally based? Do you travel to south of England? I believe this question goes to Ertan because On Clinic has a specific clinic. Then Ertan, you are the most traveling doctor.
Yes. Yeah, I come to London. I don't really go to any other areas south of London or east of London.
Because
so central London.
In north, and she's based in south, so you can meet in London probably.
Yeah, not London, Harley Street. Yeah, that's
Yeah.
Quite central.
Erkan Genç, hi Ilay. Do you apply laser on rods in conjunction with an open flat surgery? How effective compared to manual descaling, and how quick the recovery period, please?
We use lasers actually to trying to avoid surgery. So it's a non-surgical application, and that's why usually we have a good success, and we really reduced our number of surgeries we do for periodontal disease. The only reason why I would go with the surgery would be when we need to add bone, because gum disease causes bone loss, and sometimes we need to add more bone. Other than that, I would say 80% of the time we are successful enough not to go to the second stage, which is surgery. So we would just do it in select number of cases. Recovery obviously is much better and quicker than surgery. There's no stitches and so on. But there's a conventional mechanical component. That's the bit where the patient actually needs to recover from. The laser bit doesn't add to it. So it actually reduces it because it stimulates healing.
Thank you. And Aisha Jamal Channa, she's asking, my question is with Dr. Ilay Maden, what will you suggest for tooth sensitivity and bleeding gums?
Well, bleeding gums, well, two levels. These could be related or unrelated. If there's an infection of the gums, the first sign would be bleeding of the gums when you brush and so on. Again, that's more visible if you are not smoking. If you're a smoker, that may not be visible, but you would still have the infection. And so I would strongly suggest a visit to a hygienist or a dentist to see what level of infection you have. It could be very simple, just a clean and some technique instructions for you to clean better, and that could be it. But you could need possibly also more complex treatment with or without lasers. For tooth sensitivity, so if there is infection in the gums, there is sometimes gum recession that could cause tooth sensitivity, or it could be because of brushing too hard and causing some again tissue loss on the teeth. The protective layer is gone, and then you have tooth sensitivity. Or it could be because of clenching your teeth or biting on your teeth. That could be related to stress, which is very common nowadays, or it could be related to snoring and apnea. So it's all connected. So what you could do is definitely brush more. Don't be afraid if it's bleeding. You need to, bleeding means SOS, clean me more. So don't be afraid of going there with the brush, because sometimes that's the vicious cycle patients go through. It's bleeding, they don't brush, and then of course the infection gets worse. And for tooth sensitivity, there are toothpaste for sensitive teeth. You could start with that, but depending on the reason, it could be a solution. If it's a standalone sensitivity, it will block the sensitive areas so that it's gone. But if the cause is infection, clenching, and so on, so that needs to be addressed also.
What is most effective toothpaste brand you suggest for sensitive?
There are many, but Sensodyne is the famous one. But Colgate Pro Relief is also one that I personally even used at one point. The application could be like medicine, so you put it on the sensitive teeth for a minute, and then start with the brushing. Worst case scenario, if it doesn't help, we use the laser also to stop tooth sensitivity. So stopping it is not an issue for us, but we need to see why it happened.
Okay. You suggest that she can see the dentist. So from now on,
bleeding gums, yeah, definitely. Yeah.
She's not going to see any other dentist. She's going to see you. So, Şenay, hi, Arzu Hanım and Ertan Bey, are you experienced in blepharoplasty correction surgeries? I'm not experienced anything, but yeah, Ertan.
Yeah, this is an eyelid surgery, blepharoplasty, removing part of the skin and the muscle in the upper eyelid, which gives very good results. The lower eyelid blepharoplasty is a bit more trickier. because some patients might have swelling, and there is a chance that the eyelid might drop down a bit and cause eye watering. So that needs to be carefully assessed. Sometimes alternative like Botox and fillers can be tried before going into surgery. So my answer is yes, I do have experience with blepharoplasties.
That's good to know also. Aisha asked another question. What about to clear pad for teeth alignment? I think you answered.
If that's a aligner brand, I'm not familiar with this brand because I don't apply this personally, but we have 3 different brands. Again, depending on advantages and suitability for the patient and cost and what it can deliver, we have different brands, but I'm not aware of, or I'm not familiar with ClearPath brand.
Okay, Metin Nizamoğlu, Mr. Erel, can I please ask what are your thoughts about non-surgical rhinoplasty using fillers compared with surgical rhinoplasty? So my nose had a rhinoplasty operation. It's very, I haven't met with Ertan when I done my nose. I strongly suggest the rhinoplasty. It's very helpful. So I had a sleep apnea, so I should do the operation. When my doctor suggests to do division, am I right? Division. So
yes,
said you can touch little bits for the rhino. Then I said, why not? So yeah, he's asking if you suggest non-surgical rhinoplasty using fillers.
Yes, non-surgical rhinoplasty is a relatively new technique. We started using fillers mainly for the lips and around the nose and the lips area in this nasolabial folds initially, but it has moved to different areas. So rhinoplasty is a difficult operation. Up to 8–10% patients, whatever the surgery is, they may not be happy with the outcome. So maybe this has led us to use some fillers in the nose, especially the patients having a hump. When you look at on one of the sideways, and if there is a sort of raised area here, it's possible to fill above and below it and tilt the tip up a little bit. So it's a 3-point fillers can make a big change. I do have a series of patients had this fillers only, and they are very happy. Recently, I did fillers on a lady. She had septoplasty for a breathing problem, but that caused destruction of her nose. So I did fill it up in several parts of the nose on the top end, and although it looks like her nose might be, with fillers you make it bigger, it doesn't look like a big nose, and it looks straight from the side. So if something simple, I would say I would recommend doing fillers. If the patient has a big hump, then it's possible to do surgery on them, or just try the fillers first and see what happens. The fillers can last about 2 years, and then it may need a bit of top up afterwards.
Okay, I hope he got the answer. So another question, is it possible to whiten teeth without damaging the animal?
Yes. Yes, definitely. Again, we use laser technology with that, which activates the gel that does the whitening. So it reduces the time of contact of the gel to the tooth. So the side effect is minimum to none.
Okay, thank you. Fatma Arslan, thank you, Ertan Bey. This question is for Ilay Bey, please. Probably you answered her question before, Ertan. Then for Ilay, do TMJ disorder cause headaches, forehead burning, postnatal tinnitus? I haven't been using my gum shield for a long time now, since the click and stop over a year ago. Should I start using it again?
Yes, so TMJ disorder is where you have pain and issues with the joints, which connects your jaw to the head, and that is very connected to headaches and pulsatile tinnitus. But again, we need to see the reason. It's sometimes stress, and there's very little to do about it. But again, stress management techniques is something we can talk about, meditation and other options. But then it could be very well related to airway issues, snoring and apnea, because when you clench your teeth, the reaction is to push the tongue towards the teeth. That's opening the airway. So that's why you would have clenching, which could lead to TMJ issues. So we need to see if it's an airway issue. We need to have a broader look. If your jaw is wide enough, if your tongue has enough space, and if we can do the snoring treatment to increase the airway space. But also, if it's just stress, we could also use the laser for TMJ issues and muscle pain, because the laser will also increase the blood flow and decrease the pain or increase the pain threshold. So there is also symptomatic treatment in addition to dealing with the cause. So it is very related. And gum shield will help to a limit. If it has helped, that's fine. But in most cases, it's an improvement, not a total resolution of the situation. So we need to check the other causes. And yes, if you have a gum shield and if you have these issues, you should be wearing them every night.
Okay, I see the question doesn't stop. Perihan Sadowski, I was told I showed parodontis, but that was almost 30 years ago. It looks like in then stellate, I have some recession in my gums now. Would you advise reconstruction of the gums? Did I hear that correctly?
So reconstruction of the gums is possible. So we do gum graft. That will depend on how much tissue was lost at the time of the infection. So we need bone to support the graft. So if there's enough bone, especially in the sides of the teeth, if the gum is quite high in between teeth, but then you have recession in front of the tooth, that's an ideal situation where we can successfully cover the roots. That's what is called root coverage procedure. So yeah, simple photo would help even through WhatsApp. I could comment more on that.
Okay. Senay Watan, question for Dr. Dilay. Do you treat problems related to joints? I have had problem with my left side joint for almost 2 years. I hear noise every time I open my mouth, and the feeling is quite uncomfortable.
Yeah, it's very similar to the previous question. So we need to see why that is, and in most cases we can reduce the daily problems through laser. The thing is, with this specific treatment, the laser application is every other day for 10 to 20 sessions. So the logistics is a bit difficult, but the result, it's used instead of painkillers, muscle relaxants, and the gum shield, or well, bite guards. But yeah, it does work quite nicely. But again, the cause is really important.
For the laser treatment long sessions, do you charge in one payment, or they can pay divided?
In many cases, in general, the laser treatment is included in the main treatment because we want patients to come in for those sessions. It's quite low cost, like £80 per session if you have an additional laser treatment. It's for these we need to have like at least 10 sessions paid up front, because sometimes it's similar with snoring, because patients feel better and then they may want to stop, but then the effect is short lasting. We want to have a full effect, so that's why we need more number of sessions. So 3 with snoring minimum, 10 I would say with TMJ, and more if needed.
Okay. Dr. Ertan, what about zygomatic osteotomy?
Osteotomy, yes. This is a surgical procedure to make the cheeks more prominent by cutting the zygomatic bone, which is the cheekbone in here, in 2 places, and pushing it forward. I do not have much experience with this procedure. Usually the fillers which we have can do it without surgery. Especially recently they develop fillers that lasting 2-3 years. So it's possible to put 2-point fillers in this area so that it can be, the area can be made more prominent and the fillers can be repeated.
Okay, I think all those questions answered. Fatma say thank you very much, Ilay Bey. So let me go back to the chat box. I think there are additional. Is there any danger using collagen drinks? Is there any danger using collagen drinks for Ilay, I guess? No.
I would think that's for the skin. One thing I would say is something I learned in my visits for training, for teaching in Asia. Pig skin and chicken feet are very popular over there. And I was asking pig ears also. And I was kind of chatting with locals and, you know, for the taste and so on. They were saying it's because of the collagen inside. It's mainly the females who eat chicken feet, pig skin and ears. And that's basically how they look younger. But I don't know about drinks or if that has a scientific background. Maybe Dr. Erel can help us with that.
Do you suggest
Well,
collagen?
anything containing collagen is good because it's absorbed and it can support the skin. When people are aged, the collagen degrades in the skin. So skin has got some layers, the top layer, which is about 4 layers or so, and then 2-3 layers in the skin itself. So this layer loses its collagen contact and loses the elasticity. So if there are anything to supplement it, that's good. We do have other methods of increasing the collagen in the skin by either using some needles or using laser, causing some small burns underneath the skin, or fillers can help to promote skin, or injecting sometimes the collagen is possible. So there are many ways of sort of supplementing the skin with collagen and other material so that it will be tighter and look younger. So I'm not really, have a experience with the drinks of the collagen thing, but I do know that there are supplements you can buy it from the health shops.
I have a golden question, but I will ask in the end. Dr. Ilay Maden, what do you think of toothpaste without fluoride?
Fluoride, yes, is a big discussion. Also, we do have a biological, ecological, and holistic view. We work closely with the end-to-end clinic, for example, that's totally biological. And obviously, in that approach, fluoride is a no-no due to its toxic possible side effects. Now, as in medicine, with everything, if you take too much of any medicine, it will harm more than have an advantage. So it's similar with fluoride. Too much will definitely poison the person. You can die of fluoride. So if you eat a few tubes of toothpaste, it's not good. So that's why with kids especially, it's very important that they don't swallow the toothpaste. Now, the fluoride, in my personal view, would be useful if you're prone to have decay. So if both parents had a lot of decay as they were kids, and the child has some crowded teeth and cannot properly clean because of any reason, it could be physical capacity or anything else, then it will help. But if physically the teeth are cleaned well, fluoride may not be needed. And also there are some other natural products. Dr. Hisham's product, he's a friend of mine from New Zealand. You can find it in UK. Also, you can check on Google. Dr. Hisham's product, they have substitutes for fluoride, which help with healthy teeth. So I don't think it's a must, and too much is definitely dangerous. So
I just see now we have a guest from Netherlands too. Globally, perfect. So my golden question, Mr. Ertan, do you suggest stem cells on skin? On
yes, stem cells is the new way of improving the skin and making people look young. This became very popular in Turkey because they can produce the skin and produce the stem cells and apply it under the skin. We do have some centers offering it in England as well, but tissue engineering is a little bit more restricted in the UK. Stem cells comes from the bone marrow or fat is the second stem cell source, but it is also possible to culture them in the lab. So if we can take skin and culture the skin cells, so they can be applied to the patient's own skin to improve. So if you have the option, you can have it. I do use fat grafting on a weekly basis in my NHS patients, and I have seen remarkable improvements. I saw a patient only yesterday. She had a breast reconstruction on her back. From her back, the muscle brought to the front with an implant, and she had a bit of pain on the back. And I used fat grafting to that area because she was a hairdresser and she was trying to reach out, causing tightness of the skin. But having that fat injection, which has got the stem cells, sorted the problem out. So she said she was delighted with the outcome. I use the fat cells to match the other breast, usually because I do reconstruction on a regular basis. So I can put the fat on the old breast to make it a bit more prominent in some areas, or the regenerated breast with the radiotherapy scar, so that the places where the fat goes, that area becomes softer, and the hardening of the skin scars will go away, and it becomes like a newborn in a way. And I had one experience with a patient who had radiotherapy necrosis on the chest wall, and she had wounds for quite a few years. And this radiotherapy was 50 years ago, and she had very tight skin, and I used 2 fat grafting in that area, 2 operations, and her problem resolved, and her wounds healed. So fat is the magic one. If you can have an opportunity, you can have a fat grafting in any part that needs some regeneration, and that's a good one. The ones in Turkey or in some clinics.
Your voice gone again. We can't hear you.
To sleep, sorry about that. If you have an opportunity to
I have a friend clinic in Bağdat Caddesi. If you go near to Turkey, I can suggest you to visit them. So they have a specific lab which proved by the government. So they do a great job, and all the studies results are great. So I've seen some of the results that it looks 20 years younger even than the.
Yes, it's possible. I mean,
that's why I ask you.
Yeah, it is possible to have it, but in England, they've got more restrictions on that. So, I mean, I worked in Birmingham's burns unit, so we have a skin lab there that we can produce the culture, but it's the storing the cells and everything. It's a big process. We do I do also work in 19 Harley Street, so we've got a project that the stem cells will be properly applied and authorized from the government. So you just need to watch on the news.
Okay, it could be another webinar for this topic, so I can invite my friend from Turkey to join, and he can explain more better. Thank you very much. So I think we've done all the questions, and thanks for attending all these great questions. If you don't have anything to add, then I think
for stem cells, the simpler version would be PRF or PRP. I guess Dr. Erel is also experienced with those, so maybe that could be something that's quite popular. The names, it's less complicated. We use it in surgery for PRF, for extractions and so on, but I think it's also used for skin treatments. So maybe that could be something
I think they
people
take
are very interested in.
They take tissue.
PRF and PRP are from the blood, so you just get some blood, we throw some blood and centrifuge it, and then you get like gel-like or liquid.
Yes, PRP is used in Turkey very widely, and we do have that, but the blood hasn't got very concentrated stem cells. That's why I said the bone marrow and the fat cell. Fat cell is the number 2, that's the magic one. There is also a machine that takes the fat cells, analyzes it, and then removes the fat and doubles the fat sort of stem cells, so that we can inject that. But there's a 40,000, whatever, 50,000 pounds machine. We don't use that in England, but it has been used in Istanbul, I know. But this technique, what Arzu is saying, is that they're taking the skin, and then it's possible to dissolve the skin and take the cells that they're interested in, culture it, make it multiply, and then inject it
in a lab. Yeah.
Yes, in the lab. What we have it in Birmingham is, say the patient is a dark skin and had a burn in his hand. There is a patch of white skin, so they just don't like that, having 2 different colors. So it's possible to take the skin from behind the ear. It's about a stump size, and 1 in 36 cells are melanin producing cells, melanocytes. So you can culture those melanocyte cells, make them many more in number, and then inject them into the burnt area, which is white, and it picks up the color, because those cells produces the color. So it is possible to treat a burnt area, white scar, and change it to a darker scar. So that's one element of treatment. What Arzu is trying to say is that it's possible to get some other cells which will support the skin with the collagen wires or whatever, supporting the skin. So that's what they're doing it in Istanbul. And I think they started in Izmir as well, because my cousin went to see somebody about it.
Yeah, as I say, it's a big topic, so I will definitely make another webinar for it. If anyone interested, they can drop me a message. Is there anything you would like to add, Ilay? Ilay freeze. He's freezed. Okay, thank you very much for all attendees. It was a great night. I hope you enjoyed. Thank you very much, Mr. Ertan. Thanks, you covered all those questions. I say it's not going to be academic webinar, it's going to be casual webinar, but I think it was a little bit academic.
Yes, technical topics. Any questions, they can drop a line to my website and I'm happy to answer.
Yeah, I will send them your great vouchers by email and include your contact information, then they can contact you. So thank you very much. Have a lovely evening and stay safe, and hope to see you again. So Ilay back. I was asking Ilay if you have anything to add in the end.
No, was great, yeah, with the questions and everything. So thank you for the chat.
I was saying, I did mention before that it's not going to be academic webinar, it's going to be casual, but I think it was great hard topics that people asked a question for you to answer. Thank you very much. It was great. I really enjoyed. So hope to see you again for another platform.
Yes,
have a
thank
nice
you both.
weekend. And yeah.
Yeah.
Stay
Bye. Thank
safe
you.
and, yeah.
Thank you. Have a good night. Thank you.
You too. Bye bye.